Okay. Don't record. Okay. So we are going to move on into lab lecture. I'm going to talk about joints, and in this lecture you will see model pictures. These are the exact pictures that you will be quizzed on for your practical exam. So please review these model pictures, and also for lab I have made a practice PowerPoint which is posted under lab unit 3. So if you go to your Canvas shell and go to lab unit 3, there is a lab unit 3 hit list and then PowerPoint, practice PowerPoint for the bone exam. Okay, so we will start by talking about the glenohumeral joint. The glenohumeral joint is commonly referred to as the shoulder joint. It is a ball and socket joint formed by articulation of the head of the humerus and the glenoid cavity of the scapula. This joint permits the greatest range of motion of any joint in the body, and so it is also the most unstable joint in the body and the one most frequently dislocated. Okay. The fibrocartilaginous glenoid labrum encircles and covers the surface of the glenoid cavity. You do not see labrum in this picture. However, in your lab hit list, there are two structures called capsule and labrum. For testing purpose, for the online class, I will not quiz you on labrum and capsule. So it's good to know, but know that you will not be tested on those two structures. Okay. A relatively loose articular capsule attaches the surgical neck. A relatively loose articular capsule attaches to the surgical neck of the humerus. And the glenohumeral joint has several major ligaments. And we will look at these ligaments now. Okay. The first one is coracoacromial ligament that extends across the space between the coracoid process and the acromion. So in right here, the coracoacromial ligament right here. This is the, erase. So this is the coracoacromial ligament that extends across the space between the coracoid process of the scapula and the acromion. Okay, the next ligament, that actually the articular capsule is strengthened superiorly by acromioclavicular ligament, which is right here, acromioclavicular ligament. In addition, a very strong coracoclavicular ligament binds the clavicle to the coracoid process of the scapula. So from the coracoid process of scapula, which is here, to the clavicle, which is here, this ligament is called coracoclavicular ligament. Now, know that the coracoclavicular ligament is responsible for most of the stability of the joint because it indirectly prevents the clavicle from losing contact with the acromion. If this ligament is torn, as we see in severe shoulder separation or shoulder joint dislocation, the acromion and clavicle no longer align properly. Moving on to the knee joint. Okay. Okay. So we are looking at a knee joint here, and you have a picture of a knee joint model. So the knee joint is the largest and the most complex diatherosis of the body. It primarily functions as a hinge joint, but when the knee is flexed, it is also capable of slight rotation and lateral gliding. Structurally, the knee joint is composed of two separate articulations. There is an articulation between the tibia and the femur. So this is the tibia and the femur. There is one articulation between tibia and femur, and the second articulation is between the femur and the patella. So the patella is hiding here. So here you have the patella. So the second joint is between the tibia and the patella. Okay. Now, know that the knee joint has an articular capsule that encloses only the medial, lateral, and posterior sides of the knee joint. The articular capsule does not cover the anterior surface. Rather, the quadriceps femoris muscle tendon passes over the anterior surface. So right here, this ligament that you see is a quadriceps femoris muscle tendon that passes over the anterior surface. Know that the patella is embedded within the quadriceps tendon, and the patellar ligament, which is shown here, the patellar ligament extends beyond the patella and continues to its attachment on the tibial tuberosity of the tibia. So this part will be tibial tuberosity, where the patellar ligament attaches. This information is good for both lab and lecture. However, for lab, you will just be asked to identify the structure. So I might ask you, ID this, ID patellar ligament, ID quadriceps femoris tendon. Questions like this. Okay. So if we are looking at a knee joint, and on either side of the joint are two collateral ligaments that become taut on extension and provide additional stability to the joint. On the fibular side, so this bone is fibula, as we know, fibula. On the fibular side, we have the fibular collateral ligament, which reinforces the lateral surface of the joint. This ligament runs from the femur to the fibula and prevents hyperadduction of the leg at the knee. In other words, it prevents the leg from moving too far medially relative to the thigh. On the tibial side, this is tibia. On the tibial side, we have tibial collateral ligament. As labeled here, this is the tibial collateral ligament. This is the fibular collateral ligament. The tibial collateral ligament reinforces the medial surface of the knee joint. This ligament runs from the femur to the tibia, as we see here, and it prevents hyperabduction of the leg at the knee. In other words, it prevents the leg from moving too far laterally relative to the thigh. All right. Few other things about the knee joint. Deep to the articular capsule and within the knee joint itself are a pair of C-shaped fibrocartilage pads. So do you see these and this? These are fibrocartilage pads located on the condyles of the tibia. These pads are called menisci. We have two of these. We have a medial meniscus and a lateral meniscus, which partially stabilize the joint medially and laterally and act as cushions between articular surfaces and continuously change shape to conform to the articulating surfaces as the femur moves. Also know that injury to the tibial collateral ligament, so if there is injury to this ligament, that also affects the medial meniscus. So if this is torn, that affects the medial meniscus as well. Okay. Deep to the articular capsule of the knee joint are two cruciate ligaments which limit the anterior and posterior movement of the femur on the tibia. These ligaments cross each other in the form of X, hence the name cruciate, meaning cross. We have an anterior cruciate ligament, as we see in the diagram on the right hand side. We also have a posterior cruciate ligament, and the anterior cruciate ligament runs from the posterior femur to the anterior side of tibia, and the anterior cruciate ligament prevents tibia from moving too far anteriorly on the femur. The posterior cruciate ligament, or PCL, runs from the antero-inferior side of the femur to the posterior side of the femur, and PCL prevents posterior displacement of the tibia on the femur. For lab testing purpose, you will just be asked to identify ACL and PCL. Okay. Interphalangeal joints. These are the joints between the phalanges. So these and these. Interphalangeal joints. We see the head of the middle phalanx with the base of the distal phalanx. So here, this is the head of the middle phalanx. This is the base of the distal phalanx. So head of the middle, base of the distal. So these are interphalangeal joints. And we also have, in case of the thumb, we have only one interphalangeal joints. So these are called distal interphalangeal joints. I'm so sorry. Just ignore this. Let me erase this. Sorry. Okay, let's do it one more time. Just draw these. Oops, wrong again. Okay. These are these joints right here. These are proximal interphalangeal joints, meaning they are closer, and then these are proximal interphalangeal joints, phalangeal joints, and then these would be the distal interphalangeal joints. These are the distal interphalangeal joints. And when we look at the thumb, there is only one interphalangeal joints. So this is the interphalangeal joint of the thumb. Okay, so these are interphalangeal joints, meaning joints in between the phalanges. We also have interphalangeal joints in the foot, and those are these joints. So in case of the big toe, we have only one interphalangeal joints, and know that the black ones here, these are the proximal interphalangeal joints, and then if I use another color, these are the distal interphalangeal joints in red. Then we have metacarpophalangeal joints, where the head of the metacarpal articulates with the base of the proximal phalanx, forming the knuckles. So these are your knuckles. Okay, fancy term, metacarpophalangeal joints. We also have metatarsophalangeal joints, where the head of the metatarsals articulate with the base of the proximal phalanx, which are here. These are metatarsophalangeal joints. And the end.